Okay, so here is the Airway Metrics mandibular positioning system. Okay, so we're going to zoom in here so you can see a little bit more up close. On the bottom, right here, you see the snore screener, and then you have different mandibular repositioners here, so different columns. So everything in this first column is going to be, you look at horizontal positioning, so 2 millimeter protrusion versus 3 millimeter protrusion. Everything in your first column has the 2 millimeter or 3 millimeter protrusion for your horizontal. Everything in the second column is 4 to 6 millimeter protrusion. And everything in this third column is 5 to 7 millimeter protrusion. Okay, and then we also have your vertical. Okay, you see vertical right here, so vertical 4 millimeters. All this first row here is a vertical opening of 4 millimeters. So depending on how far and protrusive you need your patient to be, you can do a 4 millimeter vertical with 2 or 3 millimeter horizontal positioning, or you can do a 4 millimeter vertical with 4 to 6 millimeter horizontal repositioning, or a 4 millimeter with 5 to 7 millimeter horizontal repositioning. Now, it is not going to be very common that you are going to use anything in this column, okay? 5 to 7 millimeters is quite a ways for you to look at protrusive. So often you're not going to be using this column. It's going to also be pretty rare that you use anything here, okay? These are the 10 millimeter vertical row right here. Okay, so again, we've got 4 millimeter vertical, 6 millimeter vertical across, 8 millimeter vertical, 10 millimeter, and 12 millimeter vertical, okay? So, you know, more often than not, you're going to be probably sticking with this area here for most patients, okay? And for most patients, a 4 millimeter vertical, keeping the vertical, I will say this, keeping the vertical as small as possible is going to be better. So if they do pretty well with, you know, not opening them so far open, they're going to be better off as far coming from a jaw position, muscle, joint perspective, better off in this area than they are going up higher vertical wise. And same thing for more protrusion. Okay, so one thing I will recommend, I have done this with some of these and some of these have not been done, but see how we have a little hole in the middle for, I recommend putting some floss in there, just because you want to secure that and not worry about a patient inhaling or swallowing these little tabs, just because you are going to have the patient doing some, you know, inhaling and exhaling. You don't want them to actually, you know, accidentally aspirate. So this is the Airway Metrics system and all the different bite repositioners. And again, like I said, this is going to be your most common section that you're going to use. The snore screener is what you are going to start with. And we'll zoom in on it a little bit so you can see. I'll set it aside right here and see if we can zoom in a little bit. Okay. See how there is, okay, we've got the 4 millimeter, 8 millimeter, and 12 millimeter vertical. So when they bite down on this, their upper teeth are going to go here, lower teeth can come down here, and you're going to have your patient bite down on this and try to make a snoring sound. And they can slide their lower jaw forward more too and see if that makes a difference with, if they slide forward, do they have less of a snoring sound or does it change anything? And then you can go up here to 8 millimeters and check again with their snoring sound and if they can do protrusive, and then again 12 millimeters and see how their snoring sound is there. Again, you know, you're probably going to find most people are going to do better in the lower vertical range, if at all possible. But this little snore screener can just help to give you a baseline idea of where a patient's comfortable jaw-wise and where there's less of a snoring sound that they can make. And we'll go into a little bit more detail about this too.